hey, this is a great exercise to work your core. Or, hey, now we're going to work your core. That's a very common term now in the fitness profession, and been in the profession for 37 years. It's more of a recent term and very loosely used at that. Now, what is the core? Well, first of all, it's not an anatomical term. It's a industry made up word, maybe to justify an exercise they're prescribing. However, let's have a look at it at a closer view from an anatomical point of view and what it could possibly mean. Now, the core is basically the core of your body. Now, from an anatomical point of view, we call that the axial system, which is the pelvic, or it's not even the pelvis, it's the vertebral column and the ribs. And off that core come the girdles, right? We call the appendicular system, which is the girdles, which is the pelvis and the limbs, and the scapula and the limbs. Now, to be able to use the limbs well, we need to stabilize what we call the core or the axial system, because that is like the base of a crane. And a part of that base is the girdles, which is the scapula and the pelvis. So when we're looking at training the core or working the core, we're really probably referring more to maybe around this area here, which is the pelvis, and the lower back, the lumbar vertebrae. Because those two obviously move and work together to mobilize ourselves to do full functional type movements. So let's, in this video, use the core as training the stability of the lumbar vertebrae in conjunction with the pelvic stability. So when people say, hey, we're going to work the core, well, what muscles are you actually talking about? If someone says we're going to train the core, then you can ask, hey, what muscles make up the core? What are their origins and insertions? What is their actions and what is their function? And you'll probably get 99 times out of 100 a blank face, and they may come up with a term. They may say, oh, the abs, the abdominal region, or the ab region. Well, what is that? Now, if you're a exercise professional and you want to use the word professional, then best you know exactly what muscles you're talking about, where they are, where they connect to, what they do and how they function. It's like me talking to a mechanic and say, hey, we're going to work the engine, and I say, well, what makes up the engine? And the best thing they can come up with is the radiator, and that's the best they got. Well, there's more parts of the engine than just the radiator. So as a fitness or exercise professional, make sure when you use a term that you can be questioned on it and you can explain it in detail from an anatomical and a physiological point of view. So let's have a look at what could make up the core. And in the past, I've always said, there's about 7 muscles, sometimes 6, sometimes 8. Well, really, there are lots of muscles that make up the core. And when I say the word 7, I'm probably picking the main 7, which are the obvious 7, the magnificent 7. It could be 8, it could be the great 8. So let's have a look at what muscles that we could include in the core. Now, understanding all the muscles around here, everything works in conjunction with each other to stabilize that region. So really, there are lots and lots of muscles that make up the core, not just abs, or not just 1 or 2. But let's have a look at the obvious ones that will have a significant effect on the stability of your pelvis and your lower back region. Now, first of all, you've got the abs. Well, abs is not a muscle. It's not an anatomical term. We work at abs. Well, it's not correct. The technical word is rectus abdominis. And I'm being correct in this video because we're exercise professionals. Let's not use the slang term, the industry term, the made-up term. Let's be precise in our exercise prescription and the advice that we're giving. That way it's going to keep us razor sharp, so we're going to give the best exercise for our clients and not hurt them. So the rectus abdominis, which is the obvious one, which is down here. Now, where does that connect to? Well, it starts at the crest of the pubis and inserts up here on the sternum and the rib. So it's this muscle here. Now, even though it's probably the most commonly said muscle or used term, it's probably the least significant muscle when it comes to stabilization of the pelvis and the lower back, because it's a long thin muscle coming down here. We love to see it when all the fat's off, which is not very often. It may come out in the summer, then disappear in the winter. But ultimately, the rectus abdominis is mainly a flexor of the trunk. So it flexes, it pulls more the ribs and the sternum to the pelvis or the crest of the pubis. So it doesn't have a big strong role in stabilization of the lower back or positioning of the pelvis, but it is sort of involved in there. Now you could go to the other muscles around the side. We call them the obliques. There's 2 of them, the internal and external obliques, which originate on the pelvis or the iliac crest and insert onto the ribs, and vice versa for the other oblique. And they basically cover all this region here. So this is has a significant effect on pelvic stability because it has a lot of the attachment all around the iliac crest and the pelvis. So I like to call this like the weight training belt. This is the weight training belt because it goes all the way. The internal weight training belt you see in the Olympic lifters or the power lifters, they have an external one. Well, we have an internal one. That's the makeup of the weight training belt is the internal or external obliques. Now they're obviously lateral flexors and they're rotators, and they also have a role in stabilisation of the pelvis in relation to the ribs. Now with any weight training belt, you want to tighten and pull it in so that it increases that compression forces around the spine or the lumbar vertebrae to stabilise it. Well, that muscle that pulls your abdominal region in is called your transverse abdominis. Your transverse, and it actually inserts onto the inner lining of the abdominals, and it actually pulls the abdominal region in. And that's one of the most important muscles to be conscious of when you're training. It's not just tensing it, but it's actually pulling it in and positioning it. It's like pulling the weight training belt in. So that is your transverse abdominis. Then you also have the muscle that locks it into place, like the buckle. So you pull the weight training belt in and then you clip the buckle. And the clipping of the buckle is a deeper group of muscles called your metiphysis. Now, your metiphysis muscles actually connect between each of the vertebrae. So each of your lumbar vertebrae and your thoracic vertebrae, they connect from one to the other. So if this is one vertebrae, this is the one underneath. If these muscles are relaxed, then there's going to be some subluxation or movement between those two vertebrae. But if you draw your abdominals in using your transverse abdominis, you get co-activation of your metiphysis muscle groups. And these ones are the small ones that connect the two vertebrae together, and they virtually lock that joint into place, that cartilaginous joint, because these joints are made of, their connecting point is cartilage. So we call them cartilaginous joints. But the muscle metiphysis locks into place so you don't get that unwanted movement, and it's nice and stable. So that drawing in activation of the transverse abdominis and the metiphysis are probably the two most important ones to be wary of, because they lock the spine, lock the lumbar vertebrae into place when it comes to stability of your spine or your lumbar vertebrae or your lower back in layman's terms. Now, what else do we have on the board? Well, you have lots of other muscles that can be involved in pelvic stability, for example, or in the trunk. So at the back we have, running all the way down the spine, we have the rectus spinae. So their main action is extension of the spine, and also they're going to be involved in rotation and lateral flexion as well. So they're big, thick, strong muscles all the way down the back. They don't necessarily have a huge effect on pelvic positioning, but they make sure you're nice and upright, and they stabilise, helping stabilising all the vertebral column. So your rectus spinae would be another muscle that would be involved in the core muscles. Now you also have a muscle back here called quadratus lumborum, which connects between the pelvis and the ribs, and that's going to be involved in lateral flexion as well and pelvic positioning. So that's going to also have more of a minor role in stability of the pelvis position, which affects, remember, the pelvic position affects the lower back position or the lumbar position. So if I don't have control in the pelvis and it's wobbling, then you're going to have the joints in the lumbar spine wobbling. If my pelvis is anterior tilted, I'm going to get posterior compression on the lumbar vertebrae. It will push the disc towards the anterior, and that could cause a bit of stress. If I got the opposite, where I've got a posterior tilt or flat back, what we call, this is here, that anterior tilt is like a lordosis, or sway back, or the opposite is flat back. It means your pelvis is twisted backwards or rotated backwards, like when you're sitting down, which is not a good position, because now you get anterior compression of the inner vertebral disc. That puts a posterior pressure in the inner vertebral disc towards the back, and that over time could lead to things such as a bulging disc, a herniated disc, a slip disc, or whatever you may want to call it. So there are minor differences between those terms. So your pelvic positioning can actually affect your lumbar spine health. So make sure you have good stability and control. And what stabilizes the pelvis? Obviously, we've already talked about the internal external obliques, the quadratus lumborum. You're also going to have possibly your gluteus medius, which is one of your glutes. A lot of people think the glutes is more for the leg movement, but the glute medius actually is a lateral stabilizer of the pelvis. So stops your pelvis from going out to the side. When you do a lunge, for example, sometimes when you lunge, the pelvis twists out to the side, and some people get a burn in the bottom because their gluteus medius is statically or isometrically stabilising the pelvis to keep it in that aligned position while you go up and down. So even gluteus medius is a significant, contributor to pelvic stability, so you could call that a part of the core. So as you probably guessed, the core isn't just a muscle, it is a whole group of muscles, and I've just named 7 or 8 here that are all work together and actively involved in stabilisation of the pelvis, whether it be anterior, posterior tilt or lateral tilt or rotation, and also help stabilise the lumbar spine, so you don't go into lordosis, or you go into kyphosis or flat back or scoliosis, which is all the different angles in the spine. So they all work together to stabilise. So ultimately, if you really want to work the core or the muscles in the core, the best way to work them is to work them the way they function. And they function, all these muscles are involved in stability of the pelvis and the lower back. In what position? Well, the upright position. So if you want to train a group of muscles that function in the upright position, the best way to train them is in the upright position. So if someone's giving you a core exercise that is not in the upright position, where they're getting you to lay down on the ground or to roll on a ball or hang from a rope in the ceiling or some form of weird contraption that puts you in a dysfunctional position, then yeah, it could be working those muscles still, but they're working in the wrong position, and they're going to be trained in the wrong firing and the wrong coordination and in the wrong position to really have a greater transference into helping you stabilize your lower back and your pelvis in the upright position. So the best place to train the core is the way they function, and some obvious exercises will be just good squats, good lunges, good deadlifts, and all those good basic movements in the upright position using free weights and with control. Be careful not to do rotation, uncontrolled rotation or swinging of weights, because yes, they're going to be working the core, but they could also be putting added unnecessary stress on the joints. And I see a lot of that. This is great for the core. Yeah, they're working the core, but they're destroying your joint. So that's, if you have an injured joint, you're not going to be working anything. So take that on board and use this. The philosophy is, if you're going to say something, make sure you know you can back it up. If your question on it, can you please explain exactly what that is, why we're doing it, and how does it work? And if you can't explain that in a convincing way for using anatomy and physiology, then maybe you should go back to the books, and that would be no capo.